Now, as vaccines gradually make their way into the community, one group isn't even on the list to get the shot: children. Pfizer's vaccine is currently authorized for people 16 and older. Moderna's for 18 and older. But researchers at Duke and other hospitals across the country are now studying the shots in younger people. CBS 17's Maggie Newland getting answers tonight and talk with the parents of one boy who's taking part in this trial. Maggie.
Angela, schools haven't operated normally in more than 10 months. Kids can't play with their friends the way they used to, and many children are just desperate to get back to normal. That is one of the reasons the family I spoke with wanted to participate in the vaccine trial.
He's a big science guy, actually.
7th grader Caleb Chung is making a pretty significant contribution to science, taking part in a trial at Duke, testing Pfizer's COVID vaccine in 12 to 15-year-olds.
We sort of jumped at the opportunity.
The shot's currently authorized for people 16 and older. Dr. Richard Chung, a pediatrician, and his wife Gina say they looked at vaccine data in adults before talking to Caleb about the trial.
Kids are not the same as adults, and so we can't really assume, which is why we do the trials. But at least as a physician, I felt positive about at least that initial data.
The younger trial participants received the same dose of the vaccine as adults and also received 2 shots. Caleb had some mild pain after the first dose.
He recently got his second shot the other week and definitely felt a lot more symptoms, feeling very weak, and had a little bit of low grade. And so that sort of indicates to us that perhaps he indeed got the COVID vaccine.
But they don't know for sure whether he got the real thing or a placebo.
The point of participating was not, necessarily to try to get the vaccine in that way, but really to make sure that the study gets done so all of his friends eventually can get the vaccine as well.
Dr. Chung says vaccinating children will play an important role in ending the pandemic.
And in terms of really getting to the other side of this and, achieving herd immunity and getting to the point where transmission in the community is low enough where we're no longer technically in a pandemic, I think kids are crucial to that for sure.
But first, trials must show the shot is safe and effective in children and teenagers. After nearly a year of missing school and his friends, Caleb hopes his participation in the trial will play a part in getting the world back to normal.
To kind of do something specific to push back against the pandemic. And at that age, to have the opportunity, I think it's really great.
And Caleb is monitored with COVID tests and follow-up appointments. Duke is no longer enrolling anyone in that 12 to 15-year-old age group. They do hope and plan to study the shot in children who are younger at a later date. Reporting live, Maggie Newland, CBS 17 News.
This is really great to see, Maggie. Thank you.